Welcome to the Medical Imaging Tutorials series on culture and the healthcare professional. We're trying to discern how healthcare professionals and people of diverse cultural backgrounds interact within the medical community. We'll begin by looking at some of the oldest cultures in the Americas, the Native American and Native Alaskan. Many different tribes and traditions form the Native American culture. Prior to looking at the healthcare being provided, we need to take a look at the healthcare needed for this population. Over 500 tribes are serviced by the Indian Health Service. Medical care provided to the American Native and the Alaskan Native is from the Indian Healthcare Services. These facilities range from hospitals and healthcare centers to Alaska village clinics, health stations, and school health centers. They are a combination of IHS facilities and tribal facilities. For the traditional Native American and Native Alaskan, healthcare has historically been centered around the concept of balance in every aspect of life, which is holistic, rather than on the traditional Western view. The shaman seeks to have cures or healthcare provided not only for the individual, but the entire community. This focus is still primary in providing healthcare to the Native American. For the Native American, life is somewhat traditional and also modern. There have been a lot of changes, and a lot has remained the same. Understanding the unique and diverse cultures that make up the Native American and Native Alaskan culture is difficult because of the number of cultures that are involved and the wide disparity in geographic location. It is important for the non-Native American healthcare professional to understand the traditions and the cultures of the people with whom they're working. There must be an understanding of the characteristics of both Native American and Western medicine. In Western medicine, we focus on science, pathology, and the cure for disease. The physician is considered an authority figure that leads a large team of healthcare professionals. The culture of Western medicine actually fosters dependence on medication, technology, and preventive care, while not focusing on the holistic treatment of the patient. The Western ideology directly conflicts with the Native American perspective on healthcare. Traditional Native American healers did not have the tools that we have today in Western medicine. They often relied on spiritual and supernatural cures. For Native American medicine, the focus on health and healing the person and community are prime. Complex diseases do not have a simple explanation, and outcomes are not always measurable. Traditional Native American medicine relies on faith that the solution to a problem will be found. Often they were limited by the tools that they had, and without technology, they could rely only on faith. For the traditional shaman, intuition is primary. Healing is based on spiritual truths learned from nature, elders, and spiritual visions. Today, we're trying to merge the two ideologies of Native American medicine and Western medicine to provide health care for Native Americans and Native Alaskans. The traditional healer in the Native American culture was viewed as a counselor or an advisor. They empowered patients with confidence and awareness and the tools to help the patient take charge of their own health care. The Native American had to have a lot of knowledge, and most of it was based on experience and tradition. Even today, Native Americans and Native Alaskans are at a different health care risk when compared to the general population for the United States. Not only do they suffer from diseases and illnesses that originate from their heredity DNA, but also the environment and the traditions that they inherit. Often the environment for the Alaskan, Native, and Native American on the reservation is both poverty and poor living conditions. That is a simplistic generalization, as there is great diversity among the tribes, and they differ from small to large. The one thing they do have in common is their holistic belief, which is more than rational. Their approach to life is supra-rational. There is no separation between the sacred and the mundane with the Native American. Native American traditional healing is recognized. The National Institute of Health and National Center for Complementary and Alternative Medicine as a whole look at the Native American approach as being holistic and alloholistic. Holistic medicine is used by indigenous healers for a multitude of acute and chronic conditions and to promote health and well-being. Native Americans use traditional medicine and practices, but also seek health care from clinics and hospitals. It is frequently misunderstood that the use of modern medicine doesn't mean traditional remedies and practices can't be offered in the healthcare setting. For Native Americans, it is important to involve the community and the patient's family in the healing process and respect traditional healing practices. Today, Native Americans frequently combine traditional healing practices with allopathic medicine to promote health and wellness. Healing in Native American cultures also includes not only ceremony and native herbal remedies and allopathic medications. These remedies, combined with spiritual treatments, are an integral part of health promotion and healing in Native American culture. Medicine men or healers are often called to the local hospital to assist. The Indian Health Service is part of the Department of Health and Human Services of the United States government. They oversee over a quarter of all healthcare services provided to Native Americans and Native Alaskans. That being said, it is often difficult to provide services to a population that is located in remote geographical areas of the United States, and also to attract healthcare professionals to work at the facilities located in these geographic areas. This leads to a continuing shortage of both personnel and healthcare services. This translates into opportunity for healthcare professionals. Many U.S. healthcare providers are moving to the primary healthcare model. This includes all Indian Health Services and all Indian Health Service ambulatory care facilities. The U.S. government's healthcare and the treatment of minorities in the United States often is not what we would expect, including the exclusion of women, Native Americans, and African Americans as contributors to our Constitution and our laws. Some of the leading causes of disease and death among the Native American population are heart disease, cancer, unintentional injury, diabetes, and stroke. Because of the environment, the Native American population has a high risk factor for depression, alcoholism, and mental health problems. In addition, access to the healthcare system is difficult because of their inability to pay, the complexity of the healthcare system, lack of awareness of healthcare resources, limited transportation, and discrimination by providers of healthcare services. For the Native American population, there is also geographic isolation and cultural barriers, which include low income and inadequate services such as water, electricity, and sewage. Native Americans are a proud culture and often have difficulty in trying to integrate into the wider American culture. Poverty worldwide is a problem, and this includes on the United States reservation system for Native Americans and Native Alaskans. Poverty is a major contributing factor to poor health care. The Indian Health Services has tried to improve the health care and services that the Indian population receives. In 2008, they started the Improving Patient Care program. The focus of this program was to improve the quality of health care and also provide greater access to health care for American Indians and Native Alaskans. The program has grown and gained recognition throughout the Indian health system. It is difficult to implement such programs, and although the willingness is there, the resources and timing have taken a toll on the implementation of the program. In 2017, the IHS leadership signed a special general memorandum which requires patient-centered medical home designation for all IHS ambulatory care facilities by December 31st, 2021. When the IHS patient-centered medical home model began in 2010, it empaneled the user population to care teams in 2011. Since that time, these teams have started to turn around healthcare in these facilities. Today, many more patients are making appointments for preventative care and chronic care, and ER visits and walk-in visits have dramatically dropped. To work with the Native American population, the healthcare professional must understand some of the information or most of the information that we provided in this video and be able to adapt to working within such a system. Thanks for watching, and go to Medical Imaging Tutorials to find more cultural healthcare professional videos.